Greetings, everyone. Welcome to Macro Social Work Stories, where social workers are making a difference. We're going to take a moment, ask our guests, those who watch the replay, take a moment to go to our YouTube channel at Macro Social Work Stories. And there, if we're answering any questions or if we are have content that you are being challenged by, take a moment, subscribe, like, and share. We appreciate that as we move forward. On today, we have a treat. We have a wonderful guest. We have our guest today is Dr. Elizabeth Aparicio. I'm going to say it correctly, but Dr. Elizabeth Aparicio, who is our guest on today, who is a advocate for community participation and voice in research informing health, social policies, practices directly affecting them. So we have a researcher who's not in the ivory towers, but partnering with community members sharing their voices, making sure that the research lift their voice, their lived experience as we look at their experiences. Also, our guest conducts different community trainings in health and social service organizations. And that's why I had the privilege of meeting our guest on today at an agency here in Maryland, because she's an expert as it relates to aging out of foster care, as well as working with research and policy collaboration on different teams, translating child and family health well-being research for use for federal policymakers. And so she directs a community thrives lab, a group of researchers who practice partners that engage in transformative health research at the intersection of family violence, early childhood, and adolescent sexual health intervention. Thank you and welcome our guests on today. So welcome, Dr. Elizabeth. And so this time, just share a fun fact about yourself as we begin our time on today, something that the average person would know.
Thank you so much for having me. It's such a pleasure to be here. And yes, Dr. Jones, we worked together for many years now. I think since 2017 or so, I think is when we first met on lots of different projects. So it's such a pleasure to be here today. Fun fact, I would say this is kind of a work fun fact, but I just signed my first book contract and I'm like very scared, but very excited. So it's kind of a fun thing that's
Yay.
happening.
You can do
Yeah.
this.
Thank you. I hope so. I mean, I'm going to. Gonna make
You
it
will.
happen. Yeah. So that's a relatively recent fun fact thing that's happening.
Yes. Congratulations on that major accomplishment. You have been a part of various think tanks, research opportunities, and you mentor a lot of PhD students, a lot of, I guess, researchers as well. And so you're able to see the fruits of your labor as you embark on this new opportunity and this endeavor. So thank you. Thanks for sharing that fun fact. As we look at your experience as a social worker, we kind of focus on macro social work. We know that macro
Mhm.
social work it integrates all different levels. And can you share your journey into social work?
Sure. So I have been a social worker in various capacities now for about 15 years. And my very first job in social work was at one of the places that I had a field placement at, which is a common thing, right? Where we have our field placements in graduate school and in undergrad, and then those can become job opportunities. So my very first job, I was 22 years old. I was, not yet a parent myself, but working with young parents in foster care. Um, and I learned so much. It was just such an incredible experience. I learned so much about them and parenting and myself and systems that were working well or not so well. And my supervisor at that time said, Liz, the way that you think about practice and systems and wanting to have better evidence to inform what we're doing and wanting to make sure that people's voices are informing the services that they're receiving. I think you should think about getting a PhD. And I said, absolutely not. I have no interest in getting a PhD. Not going to do that. 4 years later, started my program and haven't looked back since. It's been really great. So I started with that job, working in direct service. It was a very intense position, interfacing with criminal justice and child welfare system, mental health, medical systems. Learned a lot about being a really good clinician, but also thinking about again, these like systems that are working well or not so well, and how we can, always be looking in whatever capacity we're in, even if we're doing direct service, always be taking that system perspective on improving the way that we're working with clients across the board. From that position, I went into a full-time clinical position and was a therapist for a while, did early childhood intervention with daycare providers as well to support little sweeties in the classroom, and just really thinking about the environmental context that we're serving kids in and serving families in. And then I started private practice as well, which I kept open throughout my doctoral program. And now I get to do research working with youth in foster care and youth experiencing homelessness and other trauma affected youth. I work a lot now with LGBTQ youth as well. Instead of doing that in direct service, now I do that through research, and that's been a really cool experience. I have a lot of folks in my research lab as well who have their own, lived expertise from their experiences growing up, and then they're bringing that to our research group as students at University of Maryland, and we are together partnering with folks like you, Gary, Dr. Jones, at Hearts and Homes, and we always have a community partner. Every project we have has a community partner, so that we are sitting down together and thinking through, okay, what are the things that you're seeing day to day doing the work that needs more investigation, that could do with some research around it. And that's how we co-create every single research project. And we bring, of course, the findings back to the organizations. We do the same thing with policymakers as well. And so a recent example was our COVID-19 study. We met with several different staffers from different federal policymakers' offices to ask them, what are the things that you need in terms of research evidence to inform policy around supporting youth in foster care and formerly in foster care? What kinds of things should we be asking youth? And then we brought that information back and, had specialized reports for them. We also like, how would you want to receive the information back? So that's sort of the way that we do things. So I kind of went on from the origin story into our current work,
Yes.
but it's
Yes.
all, for me, that beginning piece and doing the
Mm-hmm.
direct social work, direct service work has been so influential to just helping form the way in which my research groups do the work that we do, because you can't do it without the people that are right there day to day doing the work, in my opinion.
Yes. So you value partnerships. You the value of community partnerships, relationships, as you ask the questions and you ask
Hmm.
the participants what questions are important to you
Hmm.
as you move
Absolutely.
forward in that process. With looking at your community partners and relationships and your journey, and you talked about the connection between your direct practice. What are some of the challenges with connecting with community partners?
Good question.
Yeah, I mean, I think that everyone in this work is always, pedal to the ground, working really hard every single day, has a very full schedule, has a lot of things going on. So just having time, to kind of connect and like to set aside the time to think and just be together, to build relationships, that takes some time, but it's really well worth that investment. And the way that I always approach people is, I'm here to support you in the work that you're already doing. I'm not like trying to come in and do helicopter research where I come in and like do the thing and then leave, but instead that we are embarking on a way to connect our work and to just have that transformative experience in all of our different settings that we work in, right? And so I'm looking for those long-term relationships
Mhm.
and building those long-term relationships over time. So I will ask community organizations, what would be helpful to you? Like, do you like reports for your board of directors? Do you like trainings for
Mhm.
your social workers? Do you like trainings for your community health workers? What is it that would be helpful to you, in addition to like the things I know I'm going to do, which is making sure we bring the research back and like bringing the different, bringing things to you for consultation throughout the process. And all of my community partners really love that, because they often need
Mhm.
somebody who has the time and space to design the research studies that they often really wish that they had time to do. But that's the beauty of relationships, is that you don't have to do all in every, you don't have to do everything. You can be in community with one another and rely on each other for the different pieces, and not everybody has to do every role at the same time.
Yes. And so what I hear you saying is you are basically meeting their needs. So if you're meeting the
Mm-hmm.
needs of your community partners, and you're not just trying to get your mission accomplished, but you're trying
Right.
to provide a long-term experience, you're able to, I guess, do the with time when time comes an issue, you're able to smooth and get things done because of the relationships, because of meeting the needs of your clientele with the community. I can vouch for that. I remember some of your trainings you did motivational interviewing sessions 1 and 2 with my colleagues, and when we had a supervision, they were appreciative of the skill set that was provided them at the different trainings that provided by you and your colleagues. So I can vouch for what you're saying. So thank you for your community efforts. Dr. Christy, you have any questions?
I do. I was doodling while you were
Mhm.
talking, but you were talking about the beauty of relationships, and I started thinking about unpaid work versus volunteerism. So, in the
Mm-hmm.
history of all of your years, I'm sure you have plenty of experience with both. But what do you see the relationship between the two, and how to teach new social workers on how to tell the difference between unpaid work or volunteering?
Yeah. So this work that we're in is it can feel like a lot sometimes, right? Because there's so
Yeah.
much to do all the time. And so the way that I think about it is that we're going to do good work no matter what setting we're in, at whatever time, whether it's paid or unpaid, and there's only 24 hours in a day. So for me, the
Mhm.
first thing is like scheduling sleep and family time and time for myself and regeneration. And then I think about the work day and what's going to fit in that and what's my role and what might be somebody else's role. So
Mhm.
when people come to me from a community partner organization, for example, and they say, "Hey, I'm really interested in doing a research study on diabetes," for example, and I'm like, "That's so cool. That's also not completely my expertise. And so I'm going to work with you to find somebody who can connect with you around that."
Mhm.
So I think part of it is like a philosophy to prioritize rest and well-being in the midst of doing the work, and knowing that in order to do this and be in this field for a good long time, we've got to take care of one another and take care of ourselves. So I think about like the work that I'm as an academic, like I have a lot of flexibility in the work that I do during the day. But even as a social worker, I have a lot of flexibility in how I conceptualize my role. And so I would look for opportunities within the paid context to be able to, um, you know, in a in an appropriate way that was like not conflicting with the organization, but that I
Mhm.
could move forward some of those things that were maybe not like part of the formal job description, but that I wanted to make sure got done as part of my professional work ethic. I'll say that sometimes there were conflicts in that though. Like the first job that I had, I was working for a Catholic organization. And so I just have a lot of uh, reproductive justice work that I do. And so I had to kind of separate those
Right.
two things, right? And I would do the work within the organizational context that was aligned to what was allowed within the organization. But then I also, had these other pieces that I did. Like I would go and, do rallies, and I would like donate. And like I went myself to Planned Parenthood to receive services when I was in college and as an early professional. Those were things. So I kind of separated out at times as I needed to in order to really fulfill those, that full range of activities I wanted to include. But again, whenever possible, I would try to fit it into the workday and fit it in um, with the things that were already happening. So I'm all about that working smarter, not harder
Yeah.
perspective. Yeah.
And what about the good enough? I know with students,
Mm,
especially when I'd have interns where, even working on a PowerPoint deck or they want to spend
yes.
extra time because they want their best work to shine, and that belief that the extra hard work will do something of benefit. And that is
Mm,
sometimes true, but a lot of times it's not. And
right.
so sometimes it's get the good enough deck in, and the director will let you know if it needs, some, fixed slide 2 and 3. But just getting something good enough in rather than spending the extra 2 hours in order to stand out. I think we have some competitiveness amongst
Hmm.
students that doesn't translate well to the real world. I remember we've got when teaching, a lot of times it's the students who already have a low A who want the A plus. But when they get out in the
Yeah.
world, it doesn't make a whole lot of difference if you
Right.
graduated with the 3.2 versus the 4.1 with the extra credit. So I think some of that we haven't done the best as a discipline really in saying, hey, we do a lot of work and sometimes it's going to have to be good enough so that you can do the things that you're talking about, which is regenerate, spend time with families, keep your friendships strong so that we stay here and you want to keep doing the work without getting burned out. So I really appreciate all the work you're doing.
Yeah, something I totally agree with you. And something I say to my students when I'm teaching is that perfection is neither possible nor the goal. And I just make that really clear.
Nor
You
the
know, we're
goal.
here. Yeah. You know, we're here to take chances, make mistakes, and try again tomorrow. Like we're here to learn. And we will do a disservice to ourselves, our clients, our work, everything. If we're putting that expectation that this be absolutely perfect all the time. That's actually really a white supremacist value. And I will name it as that too, that like perfectionism, and that isn't helpful for community. That's not helpful for yourself. It's going to get in the way of your work. And so it's time to break those habits, especially if you got into graduate school, you figured out how to be successful in an academic system. And a lot of that has been around conformity and perfectionism. And as a social worker, we are focused on doing good work for our clients, being there for them, and moving the field forward. And that like the perfectionism gets in the way of that, ironically. So it's like a lot of unlearning of those unhelpful or things that have been helpful up to this point, but maybe saying, I'm going to challenge myself. I would even say this to students, like, it might be helpful to challenge yourself, to allow yourself to get that B+ one time, and to allow yourself to have that A-, right? Like, what if you did? And like, what would be the worst thing that happened? So that you could not spend this extra 5 hours on this one paper, and instead you could go and go to a concert, or go for a run, or go to that wedding that you really want to go to. That is probably going to be much more memorable in the long run than having the A+ versus the A- or B+.
You're reminding me of one. I think it was the worst class I taught as far as content and the students actually liking the content, because it was based on research. It was basically the class that you had to have research to take the class, and you hypothetically design a program, but you don't actually do anything with it. And it's not submitted to community or anything. So people were very frustrated generally with that class because it was a lot of work and it didn't really go to anything. But from my side of it, I learned a lot about how we've trained students the entire way until they get there, because that was their last semester, before graduating with their MSW, which was they were designing programs at all costs, in that we gave them a budget. We gave them a budget to work with, and they paid themselves the least, so they would design burnout just in how they were paying in these small budgets. And so, it took me a while to catch on to it as well, teaching it. And so at the end, I was asking questions like, okay, is this program actually going to be of benefit, or are we wasting a lot of people's time? Because there are other organizations doing it. And if we're given this amount of money, are there other ways we could use, the grant or the funding to join somebody else who's already doing the work, or just fund another position with somebody who already knows what they're doing? Different ways of thinking like that. But I think we have a gap there. I think some programs are doing a whole lot better now, but they ended up removing that class from the program. But I think that's part of that was because the frustration was real. You couldn't do a whole lot with the budgets given, and they had their hypothetical position of budgeting. And so it was a good exercise to go, wow, a budget doesn't go very far once you've paid people decently to continue a program. And so I think part of that is, even if they're going to be micro social workers and do one-on-one, these overall program, I don't know what to call it, budget theories need a little bit more work, as far as, we want the director to stay. We want the lead clinicians to stay. We want them to partner with the community, but we have to pay them well enough in the first place so they can live here.
Right.
Yeah, you all have dropped a lot of nuggets. I like the fact that you talked about perfection is not possible, nor the goal. I remember working with clients and telling students that we want progression, not perfection. And so what I think you all are talking about is quality of life. Quality of life as students, quality of life as professionals, and your research look at the quality of life of emerging adulthoods. As we look at parenting teens, homelessness, because I know you've done research on mothers and fathers. Um, what are some of the things that you see as vital to quality of life for parenting young adults?
hmm So maybe I can talk a little bit about one of the studies that we are just disseminating now as an example of that, and we can then talk about some other examples. So most recently, we conducted a study called the Next Chapter Project, and that is a study that, thank you for Dr. Jones for helping to be such an important community partner and a co-author on that paper. But we interviewed young moms who had their own experience of child abuse and neglect and had had a child, at least one child before the age of 19, and were now in that emerging adulthood period of 18 to 25. We interviewed them about their intertwined parenting and mental health needs, which in practice, in direct service, and in the way that funding happens, often those are separated. Like there's parenting programs that are developed and offered, and then there are mental health interventions that are developed and offered. But for parents who have a trauma history, their mental health and their parenting needs are absolutely intertwined. And so we designed the study to be able to look at their needs in that way. We interviewed young parents, and we also interviewed professionals who are working with them and foster parents as well about what that constellation of needs is, and then what is happening currently to address them, and what their sort of hopes and dreams are about changing systems and changing the way that services are delivered. And there are a couple of key takeaways to share from that, from what the community said. The first is to know that because we were really looking at family context and transmission of trauma across generations. And the first thing to know is that that is absolutely preventable. Trauma does not have to pass from generation to generation. Community members in our study had really great ideas about how they were working to prevent intergenerational transmission of child abuse and neglect, or how they were supporting others to be able to do that if they were in a professional or caregiving capacity. And those included things like developing a really strong social support network and making those chosen family decisions. You know, sometimes you may not be able to rely on your parents. You may have to rely on other people. And so kind of knowing that normalizing that and finding your people was really important. They also talked about making sure that services were set up to be trauma informed and available at the time that clients needed them. So especially some of our social workers who were in a unit that was to respond to young folks, young moms who had given birth in the hospital and had had a positive toxicology screen. They talked about the frustration of, getting to the hospital, talking with the mom. The mom is ready to get into treatment. She says, this is really a time that I want to go, and like I'm motivated. And then there's a 4-week waiting list, for substance use treatment. And that doesn't work, right? For when somebody is ready to address something, the system needs to be ready to receive them
Absolutely.
and to provide the services. The second really important takeaway, I would say, is that in order to prevent intergenerational transmission of child abuse and neglect and other traumas, that as parents, we may feel, because of what we've been through, that we're broken and that we're just maybe we don't have the capacity to give that. And so taking care of ourselves as parents is so important to being able to give what we need to our kids. I often think about the Japanese art of kintsugi. I don't know if you all have seen this before or heard of this. And that's the art where you take broken pieces of pottery and fuse them together using gold. And it becomes this beautiful vessel. It's in this incredible, really next chapter of its existence, ready to be filled up again. And as parents, that's what we need to do, to make sure that we're mending ourselves, taking care of ourselves so that we can be filled up and fill up our cups so we can give that to our children and to the community around us. And the last really important takeaway, I think, from this study was that we need to take a prevention, public health, social work approach across all different systems. So The participants in our study, I think I lost count of how many systems they talked about having to interface with. It was from child welfare to criminal justice to the education system, medical, mental health, education. There are so many different systems, and just the management of all of those different services and systems was pretty exhausting and overwhelming. So
Yes.
I would like to see us from a system level getting much more organized around that idea of no wrong door, and just thinking through,
Mhm.
okay, whenever a client comes to us, any one of us, in whatever way that happens, we need to really take it on and think about how can we really wrap around this family, support them with all that they need to be successful, and do the things that, especially adolescent parents, young adult parents, one thing I love about them is that they're so motivated and so like fiercely, I'm going to do something different in this next generation than happened to me. I'm so wanting to do that. And we just, I think, as from a system perspective, need to get more organized around helping them to do that, and coming alongside them to do that, and not getting in their way as they're trying to do that.
Yeah, yeah, yeah. As we look at the numerous systems that they are a part of, not
Mhm.
just talking about taking care of your daily needs of life. So they have systems, then they have regular responsibilities, working,
Right.
caring for themselves. All those things are intertwined, and so having a continuum of care, system of care, that's reasonable, and we're working together. And the fact you talked about no wrong door, transferring to another person, going from here to there. Let's work together to meet the needs of those in front of us, so that transformation can take place. Because as we talk about trauma, we know that this month is Sexual Assault Awareness Month, and so
Right.
trauma. I mean, in some families are generational. It's not talked about, and so your
Mhm.
study highlighted that we can reduce trauma. We can do things to decrease trauma and decrease the entrance of youth in different systems as we partner with them and should make sure their immediate needs are met as they move forward in our society. So thank you for highlighting some of the work that you and your partners are doing to bring about long-term change. I tell this story all the time, how my mother was a case aide and my sister was a case manager 20 years later, working with the children that my mother worked with.
Mm.
It's a problem
Mhm.
in our society. And so I'm glad that you're a part of teams that are doing things to reduce that, reduce entrance of generational entrance into a system. And some population, it was never designed for them to be a part of in the first place. And so it's very
Yeah.
important that the work that you're doing on your team. So thank you for that work.
Yeah. Yeah. And just to really implicate the systems here, since we are in a macro social work podcast, I want to just mention the surveillance issue for young parents, which is, for those who may not be familiar, young parents are, um, they have a lot of people around them looking at them, saying, how are they doing? Are they going to be okay? Are they going to make it? And they're much more likely to be reported for child abuse and neglect, and for there to be an indicated finding of child abuse and neglect. And so this intergenerational piece is partly because, yes, like, as a society, we're not really set up to really support parents well. And so I think there's a lot of things that we could do to improve that. And then secondly, we have lots of eyes on these families, and they get reported for things that perhaps are, um, if it was a 30-year-old mom, that we might like not really call it in, and we might say, I'm worried about this because she's 17. I wouldn't be so worried about this if she was 30. And I just want to trouble the waters a little bit around that, and just kind of put that in our mind that it's the child welfare system is a reactive system, in the way that it's designed right now. It is a carceral system. It's tied to the justice system, in terms of charges for child abuse and neglect.
Mhm.
And I would love to see us really getting on the prevention side of that, and really thinking about what
Mhm.
is it that we need to give families to support them to have the strongest start possible, and be able to really do all of those things that they want to be able to do in their lives. And and instead of using the system in a punitive way, that instead we're saying, let's see this as an opportunity. This is somebody who has rightfully chosen to have a child at this time, as everyone has the right to do within as they, with their own bodily autonomy, how can we take care of one another as a community and make sure that every child is taken care of and every parent is taken care of?
Yes, I guess when every child's taken care of and every parent is taken care of, you have a better community. The well-being of all community members are met in that
Exactly.
process. Yeah, it's very important. And so, as we wrap things up on today, we just want to give you the last word. As you continue to partner with students, as a mentor to many of us when I was a student, now I'm a colleague. And so, any final thoughts on emerging scholars, social workers who didn't know that public health should really be intertwined with social work?
Mhm.
Any final thoughts?
Yeah. Yeah. So here's the thing is that social workers and public health people are all doing the same thing. We just use different language to talk about what we're doing. Okay. So I think of social work as both a degree and a profession, right? And public health is the same way. It's both a degree and a profession and like a, set up system. So don't box yourself in, I would say, to one way of thinking or doing or being. Think about what's necessary to move the field forward and to move your work forward, and who are the partners that you could connect with in order to make that happen. One thing that's on my mind that's really concerning right now is all of the anti-LGBTQ youth legislation that's been coming forward.
Mhm.
And so, in order to, with that in mind, of protecting all kids, protecting all families, all parents, I would say too to just, not feel that you have to be the one and only on any one topic, that there's always an organization, there's always a group, there's always organizing that's happening around whatever you're interested in. So find your people, surround yourself with people who are for you, who are going to nourish you and lift you up, and who are, you can join with in those challenges. Don't try to go it alone, because we're not designed that way as human beings. We're designed to be in community with one another, and we can be so much more powerful when we do that, when we're in community.
Yes. Yes, thank you. Your research and our time together, you had emphasized community. One of the great philosophers of all time, former President Nelson Mandela. If you want to go fast, go by yourself. If you want to have
Mm.
impact, go in a community and a village. So we thank you for the community work that you're doing and will do as you bring about transformational lives in the communities of emerging adults. Thank you for being here on today for
Thank
Macro Social
you.
Work Stories. Thank you.
Thank you for
Thank
having
you.
me. I really appreciate it.
All right.